A huge part of the reason that people go through clear aligner trays or any sort of orthodontic is a lot of times for aesthetics. I mean, sometimes it can be for form and functions, and a lot of times it is. But a byproduct is almost always the aesthetics, right? I think that is a big part of it. And I know for me and for him, a lot of times I won't take it off until I know that the patient is satisfied, right? I think once that patient gives me the okay, like, yes, I am happy with my smile, I'm happy with the way that things turned out, then we'll finish treatment. And I think if you do that as the doctor, then they will almost always end up with the results they want, and in turn be happy with their investment and happy with the change that they made in their smile. There's lots of people that will get the braces and not wear the retainers, and I really make sure to harp on that at the beginning, right? I mean, this is a lot of, it's expensive, right? I mean, it's a lot and it's an investment, but you want to make sure that you are, maintaining that investment and protecting that investment by wearing your retainers. So I make sure I harp on that a lot at the beginning, and I do the same thing when it comes to wearing trays, right? The one thing about clear aligners that separates them from, the brackets and wires is that brackets and wires you can't take off. So the teeth are going to move like they're supposed to move. With clear aligners, it is very patient dependent and it is very patient compliance dependent. So if you're taking them out all the time to eat and not putting them back in, then things won't progress the way they're supposed to. So I really make sure that patients understand that going in. And if I have any questions like, young kids, teenagers, anything like that, a lot of times I will push them towards orthodontics and put brackets and wires on, just because if compliance may be an issue, it's something to definitely worry about. And the same thing happens with clear retainers. We absolutely make retainers for patients after it. We even do some whitening stuff for them and bleaching trays as well. One thing that we absolutely do clear aligners for patients after, or clear retainers for patients after they finish their clear aligners, and it's very important that they wear them. One thing that we don't do a whole lot of here is we don't put the permanent retainers on. We both feel that, obviously they're very hard to clean. And then a lot of times, especially on the upper, we find patients are always biting on them. It can mess with their bite, can mess with the way that they chew. So we really don't like to do that. We really like to stick to the clear aligners and the clear retainers. But if someone is really insistent on that, there's plenty of orthodontists around town that will put them on as well.